Welcome to Trials and PIs. I'm here with Dr. Holm from Denmark, who will be discussing the close-up trial. So please tell us, what is the rationale of that excellent study?
Well, we conduct a lot of PCI in our center, of course, and the rationale for doing it is that there's been a number of meta-analysis and registry studies that have identified the use of vascular closure devices as a predictor of a better outcome, but it has not been proven in randomized trials. So we looked for the device of choice, and we looked to the Swedish SCAR registry, where we found the femoral vascular closure device, which in 2007 had an excellent safety record in that registry.
Okay, so you're evaluating the femoral device,
yeah,
compared to manual compression.
Exactly.
So what were the results?
The results were that our primary endpoint was the incidence of in-hospital large hematomas, large groin hematomas, and there was 6.7% of large hematomas in the manual compression group versus 2.2% in the femoral group.
Okay.
A statistical significant difference.
Okay. Now, was it during diagnostic procedure or interventional procedures?
Yes, diagnostic procedures.
So exclusively diagnostic procedures.
Yeah.
So what were the main inclusion and exclusion criteria?
The main inclusion criteria was coronary angiography, and we use 6-French catheters for that, and the patients were excluded if some kind of intervention was performed, further intervention, like measurements or PCI.
Okay.
So, and
any other results? I mean, was it easy to use that device?
yes, the operators was very happy with the device, and they, although we haven't got the numbers yet, they felt there was a very short learning curve using that device. It's very simple to use, so they felt quite confident in using that.
And compared to manual compression, there was no increase in infection, or what were the other results, secondary endpoint of the study?
Yes, our access site major adverse vascular events was very low numbers, 1% in the manual compression group versus 0.6% in the femoral group, so very low numbers.
Okay. And how many patients overall in the study?
1,000 patients.
Okay, so it's one of the largest, if not the largest study.
I think it's the largest. So
excellent work. Yeah. I mean, so what are the clinical implications then of closing device nowadays?
Well, we are heavy users of closure devices because of the improved efficacy, that you have a short closure procedure, and that's very important for the logistics in our cath lab. And this study confirmed that we can use vascular closure devices with this high efficacy and with a high safety also.
Okay. Do you mean the patient could ambulate quicker than the manual compression?
We measured that, and that was we had a 1-hour bed rest recommended in this study, and there was no difference between the groups after that. So patients were in the bed for roughly 1.5 hours in both groups. So no
per
difference.
protocol, it was the same time for both groups. Okay, interesting. Now, can you extrapolate if we would use a device during intervention?
Yes, we have of course tried that, and it works very well in that setting, and we haven't investigated that yet, but in other registries there has actually been an improved advantage of using VCDs in more complicated cases compared to manual compression.
So how would you recommend to clinicians to use a device if they have to undergo PCI with current antiplatelet anticoagulant? You know, how would you use it? How much time before they ambulate?
Well, our recommendation in our center is 1 hour still. 1 hour in both just coronary angiography and also after intervention.
Okay. And do you do routine angiography of the femoral to make sure there's no stenosis? Is there any contraindication?
No, we don't do that in our center, so on a regular basis.
Okay. Thank you very much, Dr. Holm, for sharing this very interesting study with us. The close-up really showed a new device, a FemoSeal, as a closure device in diagnostic procedure that showed that you could successfully maintain hemostasis and also had an increased safety compared to manual compression. So again, this study is very promising for future evaluation during interventional procedures.